Hello, my name is Fadi Al-Fayoumi, and this is my final presentation for the Capstone B project at Washington State University under the title of Introduction of the Vein Clinic Service at the Heart and Vascular Clinic. And with my presentation, we will go over company overview, industrial analysis. We're going to talk about customer analysis, comparative analysis, touch on marketing plan, talk about operation and technology plan, and eventually finish with talking about the organization, social responsibility, and a touch on the financial plan. So with the company overview, the Heart and Vascular Clinic will add the vein service to already existing cardiovascular problem services. And with that, we're going to provide a new avenue for early detection and treatment for spider veins and varicose veins. Normally, the primary function of the veins is to pump blood back to the heart, and that's being done against the effect of gravity via heart valves, the function of which is to allow the blood to flow toward the heart in one direction and not to the others. If those valves become non-functioning well for other reasons, including genetic problems, pregnancy, trauma, medications, then the blood will become congested in the blood vessel, and eventually that vein will become dilated or congested. That will bulge under the skin in the form of spider veins or varicose veins. Well, a spider vein is a small superficial vein under the skin that measures only 1 to 3 millimeters in diameter. But if the blood vessel becomes bulgier and bigger, then it's called varicose veins. That eventually can have clinical consequences. It can cause swelling of the lower extremity, what's known in medicine as edema, or it can cause inflammation in the skin of what's known as dermatitis, and eventually ulceration of the skin can happen, and that's called venous ulceration, the potential of which can become infection and ultimately leads to amputation of the limb. And therefore, vein problems are not only cosmetic, they can actually have clinical consequences which can be disastrous. So the treatment in the past used to be surgical removal, where a big scar will be introduced across the lower extremity or the thigh, and one vein will be removed. That vein used to be called the great saphenous vein. They assumed in the past that all varicose vein problems in the lower extremity are because of this vein being incompetent. So the answer was to remove the vein completely. The technique was successful of removing the problem from the patient in about 40 to 50% of the time. With the introduction of ultrasonography technology, we found out that in at least half the patients, that particular vein is not the problem, and there could be other problems. So with the introduction of ultrasound, new technology evolved where surgical techniques are not needed anymore, especially the invasive ones. With the new technology, by vein access through a needle can be introduced to the vein, and then a wire can be introduced inside the lumen of the blood vessel. Eventually, that sheath can be introduced inside the lumen of the vein, and through a sheath, a catheter can be applied to go all the way to the lumen of the diagnosed incompetent vein. Eventually, with this catheter, which can be a laser catheter or a radiofrequency ablation catheters, which are terms given to different types of catheters used to induce clotting or closure of the vein that is incompetent. So basically, with laser ablation, we introduce the catheter inside the vein, and once we introduce it, laser will be applied, and that energy will be transferred into heat, and that eventually will lead to the collapse of the blood vessel. We're having two lumens. We're having two walls inside the lumen, and then those two walls will collapse on each other, and the vein will shut down, will close, and therefore the bulgy vein will not be there anymore. It will be closed, and the blood will take a different path to the heart, and then the clinical consequences of the edema, the skin inflammation, the ulceration, the infection, the amputation have already been prevented. Well, how effective the therapy is. That therapy can be applied only if the vein is at least 1 centimeter away from the skin, because if we do it for a superficial blood vessel that's very close to the skin, burning of the skin can happen. And therefore, in the case the blood vessel is too big and too close to the skin, we can do something called phlebectomy, where A micro incision, very tiny small one that doesn't leave any scar tissue behind, can be done, and the vein can be pulled by a small needles outside the body. This also can be complemented by something called sclerotherapy, where those spider veins or the millimeter veins that bulge the skin can be injected with an agent. The effect on those small tiny blood vessels will be the same effect as the laser catheter inside the big vessels, and that will be introduction of a clot inside those tiny small vessels, so they will close completely and the blood will take a different path to the heart. How effective is the therapy? Well, you can have a patient like this where they have bulgy veins, varicose veins, and they also have spider veins. By doing laser ablation of the incompetent vein under sonography technology, removal of those bulgy veins by phlebectomy, injecting those small spider veins with sclerotherapy, you can start with this and end with that. And yes, no surgery, no scars, no hospitalization, purely outpatient procedures. In 1 hour, the patient is driving himself home. So now we'll go over the company overview. And the vein clinic service will be introduced as a new service to the cardiology practice of the Heart and Vascular Clinic, an already established successful practice operated by myself, Dr. Fadi Al-Fayoumi. And the approach we're going to use is a comprehensive approach. There is no one treatment fits all, and there is no one therapy being applicable to every single patient. Therefore, the comprehensive approach will be composed of consultation with the doctor, which is going to be for free, applicable of the physical examination along with the diagnostic methodology with Doppler ultrasonography. Once the particular blood vessel responsible for this particular patient varicose veins is identified, different methodology of treatment will be offered, including laser ablation, radiofrequency ablation, sclerotherapy, phlebectomy based on the patient anatomy characteristics we talked about before. As far as the service being provided, myself, who is going to be the main physician in the field, I am board certified in 9 board certifications in the field of cardiovascular medicine. My staff have been very well trained when it comes to the medical assistant and the nursing in the field of vein disease. The cardiology practice has a very well established referral base by the primary care doctors in the area. And when it comes to the Brownsville, Texas area, where the vein clinic service will be offered at the current cardiology practice, literally the competition is close to zero when it comes to identifying what a comprehensive approach of the service we're going to provide is. As far as the industrial analysis, if we look at the statistics in 2012, 3.8 million vascular procedures were done in the US with a reimbursement exceeding $1.8 billion. The United States markets is one of the most attractive healthcare market because it still operates under the fee per service rather than social medicine. Despite the fact that our reimbursement has come down over the last 3 to 4 years by Medicare and Medicaid, and with the expectation of Obamacare coming to the market, this might reduce the reimbursement per service when it comes to the patient reimbursements. However, living in the area of Brownsville, Texas, we have a lot of patients who are not insured, and therefore with the Obamacare that's upcoming, a lot of those patients will get insured, and that will increase the absolute volume in our clinic. Medicare and Medicaid services have also encouraged the application of outpatient procedures, which are less expensive than hospital admissions and inpatient procedures. Since the vein clinic, 99% of our procedures will be outpatient procedures, and therefore we expect the volume to compensate for the reduction in the reimbursement per patient. And so the industry itself looking that it's very attractive, and we're expecting for vascular procedures to grow at a rate of 2 to 3% per year over the next couple of years. The clinic is going to operate in the area of Brownsville, Texas. Our population is about 250,000 people, but we're also expecting cash-paying patients to come from Matamoros, Mexico, where a lot of people will come to seek healthcare in the United States, and they are cash-paying. If we look at the lack of adequate competition when it comes to the comprehensive approach we're offering, then we are realistic by including the city of Harlingen, Texas, and McAllen, and therefore our population might be in the range of 750,000 to about 1 million. Again, back to the competition. If we Google the area of Brownsville, Texas, and look at the competition, three other vein clinics will pop, operated by two primary care doctors and one cardiovascular surgeon. But those are using the cosmetic approach, where they're using sclerotherapy, and in some instance, they might use phlebectomy or microsurgical techniques to remove the vein under the skin. But they're not using the comprehensive approach, and therefore, clinically, their recurrence rate will become high and their patient satisfaction will be low because the underlying problem is not being fixed adequately. With our comprehensive approach, since we're using all the technology to define what's causing this patient particular problem, we're expecting a very effective therapy and a low recurrence rate. So if we're using the Google criteria to look for vein clinics, we're talking about three other vein clinics in the area. If we're using our business analysis, then we're expecting our real competition to be close to zero. The marketing plan tactics are multiple, but our main marketing plan tactics will be the primary care doctor referrals, who are going to be aware of the fact that Dr. Fadi Al-Fayyoumi is introducing the vein clinic as a new service to our successful cardiology practice. The word of mouth by the patients when they see the effective therapy, and they're gonna go and talk about it to their friends, to their relatives, and to their family members. And our local marketing plan will be the competent medical staff who are going to provide the right environment for the patients to walk in, be happy, and all of a sudden this invasive cardiology practice is also offering a spa-like environment when it comes to the treatment of varicose veins. When it comes to the operation and technology plan, the key operational process to our success will be the comprehensive approach we talked about. The facility will be using the Heart and Vascular Cardiology Practice Clinic, which is operating at Valley Baptist Medical Center in Brownsville, Texas. Our labor requirement will be the 4 medical assistants, which are already helping Dr. Fadi Al-Fayyoumi in the practice, and they have been very well trained in the field of vein disease. We're expecting to hire a nurse who is going to add in the process of the education and assist in the operations, which are going to be done as an outpatient. The quality control will be based on guidelines issued by the Center of Excellence, including the Mayo Clinic, the Society of Vascular Medicine, and the Cleveland Clinic. And we're going to be meeting those standards by the high quality control and high quality service offered to the patient. When it comes to the equipment, we're going to be buying the vascular ultrasound machine. We're also going to buy the laser radiofrequency ablation machine, sclerotherapeutic agents, gauzes, needles, etc. for very minimal equipment being required otherwise. And the inventory control, once the main equipments are being bought, including the laser equipment, the ultrasound equipments, we're going to be using the case-based approach, where it's going to be based on demand. We're going to have supply for 5 to 10 initial patients, and after that will be based on the schedule, and that will help us to control our inventory very well. As far as the technology plan, we are going to implement the electronic medical records to ensure that the patient records are well stored and the high quality imaging are stored to show the patients before and after results adequately for them. So as far as the organization, the president will be myself, Dr. Fadi Al-Fayyoumi. The cardiology service, which will be including the ultrasonography of the heart, the nuclear stress test will still be operating. The ancillary service will be where those machines are available, and the technicians will operate those machines. And then eventually comes our new service, the vein service, with the nursing staff, which are going to take care of the patients along with the president or Dr. Fadi Al-Fayyoumi. The social responsibility, well, it's a medical clinic, and therefore any medical clinic is offering social responsibility for the society by introducing a healthcare problem solutions. With us, we're introducing a new problem that in the mind of so many people, it's only cosmetic, but we're also introducing the treatment for it along with the education about the fact that it's not only cosmetic, it's also therapeutic and prevention of disasters in the. As far as the financials of the practice, we're expecting a revenue in the range of $117,000 in the first year with a growth of about 5 to 7% annually. Our net income is not going to exceed 55 to 60,000 in the first year, and our expectation for that to grow over 177,000 in 5 years. So that was my final presentation for the Capstone B project at Washington State University. My name is Dr. Fadi Al-Fayyoumi, and thank you very much.